Who's responsible for nutrition? As a nurse, I would say, well, it's going to be us, isn't it? Okay? So isn't it bizarre, then, that we act as trolley dollies and give out all the food, yet we let the domestics collect it in? The domestics, then, are the ones who are finding out how much protein did they eat, how many carbohydrates, what minerals and vitamins, and what have they eaten? Well, what interest is it to the domestic? It'd be far better that domestics gave out the food and then we collected it in. And then maybe somebody would have found out that I was dying of starvation. I went into that hospital weighing 12 stone. 6.5 weeks later, I weighed 8 stone 4. I'd lost nearly 4 stone in 6 weeks. Now that's better than the Atkins diet, that, isn't it? And who was it that spotted the fact that I was dying of starvation? Was it any of the nurses? No. Doctors? No. Nutritionists? No. It was the domestic. I'll tell you another thing about domestics. Because they have to clean your bed, you get someone to talk to for 5 minutes. And this young domestic used to come along, right, and she was brilliant. She used to, and we used to chat. I knew about her kids, I knew about where to go on holiday, and she knew about me, and she was my mate. Patient handling. This frustrates the hell out of me, because in patient handling, we go through this stupid thing, and I'm part of it because I'm part of a university, and I take people through their yearly manual handling nonsense, right, where we get somebody who's got nothing wrong with them, and we use slide sheets to slide them up and down the bed. This is an orthopedic ward. They didn't know how to lift and move somebody that had 2 broken legs, broken arms, broken ribs, broken pelvis. They had no idea. Every time they touched me, they left me in agony. Now, just to prove that it didn't have to happen, right, I've had over 800 odd x-rays. I'm worse than Hiroshima, me. I must glow in the dark. But the thing about it is, every time I went down to x-ray, they took me off the trolley, onto their table, off the table, back onto the trolley, without hurting me one little bit. Because the chief radiographer wouldn't move me until she had 5 people. No, stay there, Austin, there's no rush. I'll wait till everyone's here. Now that is a luxury that I am not going to say we can't afford. Because as a patient, I'm telling you, this nonsense about going once a year to learn how to move somebody who's got nothing wrong with them, why don't we actually look outside the box and start thinking about how do we move somebody that's got broken arms? How do we move somebody that's got no arms? Bilateral arm amputee. How do you move them? Nobody actually shows you the difficult stuff. We want to get it over with because we've got a tick in the box, and then you can't sue the hospital because that's what it's about, you know. It's about covering their back. If they actually cared about patients, I think we might start looking about how do you move somebody that's got no legs? How do you move somebody that's got a fractured pelvis? How do you move somebody that's got a broken spine? And then I'd start to think, yeah, maybe they do actually want to do something.